So to start our neuro section, we'll go over Bell's palsy. We're going to try and differentiate this from stroke. This will be a short one. What Bell's palsy is a paralysis of the seventh cranial nerve, which is the facial nerve. There are actually 5 branches of it. So depending on where the actual lesion is, you can have some of the branches being paralyzed, or you can have all of them if it's more centrally located. The facial nerve actually does a couple things here. So it does innervate your facial muscles here, like you can see. So if there's paralysis of the seventh cranial nerve, what's going to happen is they're going to have uh, a lot of facial droop here because the muscles don't have any tone to them. It also helps with your taste, and it innervates the stapedial muscle. If you remember from your inner ear anatomy, the stapes, this is the muscle that helps control that, and the facial nerve controls that. As far as your exam goes, the patient should be directed to forcibly close their eyes, and then your normal sort of CBA stroke assessment. Uh, Symmetrical face, smiling, puff air into their cheeks, see if they can actually wrinkle their forehead muscles. So with Bell's palsy, that's going to be impossible because the facial nerve actually innervates that. As far as the abnormal findings go, they're going to have an inability to bury their eyelashes. It's because of a problem they have called ptosis, which we'll see here in a second. You're going to have your normal asymmetrical smile. They're not going to be able to actually hold air in their cheeks when they puff it up, so one side's going to actually kind of deflate there. And they're not going to be able to wrinkle their forehead like a CBA patient would. The reason they can't bare their eyelashes here is because of a problem called ptosis. So you can see where one eyelid is slightly closed on a couple of these people. If you look like on the older gentleman here in the middle, that's not quite ptosis here. That's something else, but it's going to be more like Forrest Whitaker there in the corner that has one eye that droops, and that's going to be called ptosis. This is a sign of Bell's palsy. Sometimes it's just normal for people. So when we try and differentiate, you need to know that Bell's palsy is a peripheral nerve lesion, whereas a stroke is central. So you're going to have full face involvement on one side, but with a stroke, the forehead muscle actually spared, so they can wrinkle their forehead and they can close their eyes. But if you have Bell's palsy, because there's no tone at all of your muscles of your face, you're not going to be able to close your eyes. In addition, stroke's going to have weakness on one side of the body, right or left, but Bell's won't. They're just going to have that facial droop.